If you'd like to utilize your insurance benefits for your care with us, you will need to submit for what is called out-of-network reimbursement benefits. Although the providers at Kentland Psychotherapy are not in network with any insurance plans, most of our clients receive significant partial reimbursement for their claims. To determine whether your insurance plan covers out-of-network benefits, we recommend you inquire with a customer service representative at the number on the back of your insurance card. If you see a secondary number specifically for behavioral health or mental health, it's important that you call that number, since some insurance companies subcontract out this part of their plan. Here are the questions you'll want to ask your representative. Do I have out-of-network benefits for mental health? If their answer is yes, then you can expect to receive some reimbursement for the receipts you submit. If they indicate no, you do not have out-of-network benefits, this means that the fees you pay to us will not be reimbursed. If you have a health savings account or flex spending card, you will be able to pay for your sessions with pre-tax dollars. Also keep in mind, if you have significant out-of-network medical expenses, you might qualify for tax relief through itemized deductions on your federal returns. Ask your CPA for details. If the answer to your question about out-of-network benefits is yes, you should ask, what is my annual deductible for out-of-network benefits? Have I met any of my deductible this calendar year, and if so, how much? Your deductible is the amount of money that you pay out of pocket before the insurance company begins reimbursements. Plans can include a deductible as low as $300 and sometimes as high as $7,000, so the answer to this question is critical in estimating your cost share. In fact, you will need 3 pieces of information to accurately calculate your cost share. First, your deductible. Second, the percentage of reimbursement the insurance company pays you back after you've met your deductible. And lastly, the monetary value they attach to an appointment type called reasonable and customary. Once you know these 3 variables, you can very accurately estimate what your cost share will be. After learning about your deductible, you should ask, once I've met my deductible, what percentage reimbursement can I expect to receive from my out-of-network benefits? Tell the representative that you mean outpatient mental health appointments. If they tell you that they reimburse 80%, it's important to understand that they mean 80% of what that insurance company has predetermined as a reasonable and customary fee. Think of it this way. That figure is what the insurance company has decided is an average and expected fee for which they are willing to reimburse their percentage. For example, for a 45-minute psychotherapy appointment, if the insurance company determines $200 is reasonable and customary, and your therapist charges $180, you can expect to be reimbursed the entire 80% of the fee you paid, or $144. On the other hand, if they determine $130 is reasonable and customary, you can expect to receive a reimbursement check for 80% of $130, or $104, even though you paid $180 for that session. So now you have 2 of the 3 data points you need, annual deductible and percentage reimbursement. Finally, you'll want to ask about your insurance company's reasonable and customary values for the treatments you will most likely receive under our care. For example, a standard 45-minute psychotherapy appointment has a CPT treatment code of 90834. If they will share their reasonable and customary figure for this code, you can calculate your cost share as described earlier. Often the representatives will be reluctant to volunteer this information, but these are the details of your healthcare plan, and you have every right to this information. You can use this formula for any out-of-network clinician. To run the numbers for our therapist, go to our website's Contact drop-down menu and choose Rates and Insurance to see our therapist's current rates. We understand that many people feel uncomfortable asking about fees, so we post them right here on our website. You don't have to call to learn about our prices at Kentland Psychotherapy. It's one of the many ways we stand out in the field. Also, although we do not submit insurance claims on behalf of our clients, we are happy to review your paperwork with you to ensure that you are completing it properly and are comfortable submitting reimbursement forms going forward. Call or email our Director of Administrative Hospitality to set up a time for this assistance. She can also provide you with other CPT treatment codes you might want to inquire about with your insurance company, such as initial consultations, 60-minute psychotherapy appointments, psychoanalysis, or medication management services. Finally, if you have a specific question about utilizing your health insurance for marriage counseling, check out our explainer video on insurance reimbursement for couples on our Couples Therapy page.